October is Breast Cancer and Breast Health Awareness Month. We are going to talk about how breast health and being transgender go together.
Focusing on the LGBTQ breast cancer needs.
Oh, well, no one's really talking about this.
Pandemic, I realized I was surrounded by boobies all day. And I was like, that's it. I'm a boobie-da.
Yeah.
You designed your own life.
It's been fun. I saw a recent study that, over 50% of young people get their health information from TikTok.
So, on Booby
Right.
Doll, they said,
I see a lot of misinformation on social media.
Can you tell us what people who are transgender need to know about breast cancer risk and screening?
That's a very important topic. So if you are a male who transitions to a female and you are taking the exogenous hormones, then you are, I think we also have to talk about male breast cancer. Beyonce's dad had breast cancer. A mastectomy will lower your breast cancer risk by up to, greater than 90%. Well, they say all women, but I really think it's all individuals, especially those of Ashkenazi Jewish or Black ancestry. We also have to get comfortable doing a monthly self-breast exam, knowing how your normal feels, because everyone is at risk for breast cancer. If you have breasts, then you are at risk for breast cancer.
That's a good point.
Let's talk about breast.
Let's talk about you and me.
Let's talk about all the good things
and all the bad things.
Welcome back to Boob Tube Podcast. This is episode 56. I'm Chantel.
I'm your best friend, Jaleesa.
October is Breast Cancer and Breast Health Awareness Month. And we are here to talk about a conversation that most people are not talking about, perhaps not even thinking about when it comes to everybody's health. We are going to talk about how breast health and being transgender go together and some things to think about when it comes to those two. But before we get into it, let's take it to the streets.
What advice about breasts would you give to a person that's transitioning or has transitioned to a woman? So, a person born male who has transitioned or is transitioning to female.
I would say within the transition to just get the knowledge of, how to take care of your breasts and what comes with, the breasts, like tenderness. If, I know they probably don't have a cycle, but still might go through having tenderness or, swelling or something like that.
Okay.
Can you think of any breast health concerns that trans individuals may encounter? Like?
Trans, so you talking about male or female going to a male or a male going to female? Yeah, you're gonna face some muscle tissue issues because you're trying to grow something that wasn't naturally going to be that big. If you a male trying to be a female, you're gonna have some muscle damage. I know that.
Okay.
Well, especially if you try to get a cheap pair or something.
Cheap pair, yeah. You don't have the funds to get some nice C cup or D cup. Yeah, that's why I have the money. You get a cheap pair of whatever in there.
And they gonna give you something that ain't right.
Okay. Can you think of any breast health concerns that trans individuals may encounter?
Any breast health concerns?
Mm-hmm.
Trans either way?
Mm-hmm.
I don't know that. I don't know if they would experience anything just specifically because of that, but I know that both men and women can get breast cancer.
Okay. That is factual.
Okay.
So I thought the women gave good advice, especially just like researching, I guess, what it is like to have breasts and what comes with having breasts. And I don't know. Like, I know not having cycles might be one thing, but to my knowledge, I can be ignorant to a lot of this stuff. But I think that they like take some hormone stuff for people who are growing breasts, like to help them to grow breasts, right? So I don't know if some of that does anything with your hormones that would normally cause some breast tenderness or anything like that. So, but that might be something.
Yeah, I do know it helps to when you're grown to help grow. I just wonder how big they get though.
It might depend on what your body fat composition already is.
Yeah, that makes sense. Well, if people could take hormones to grow, how come more women instead of getting implants, why don't they just take the hormones?
That's a good point.
Is it so? Is it just for? Surely it's not just because I think they do have to go in and have a surgery. I don't think it's just to help grow. I don't know. Guess we're gonna learn that later on. What I guess.
I don't think, like, I think there is stuff to help grow, like, some natural fat in the breast.
I wonder how big it get
But
though.
I don't know. I don't know. I don't think they necessarily form
Breasts.
exactly the same way that females form, because I feel like they look a little more gynecomastia-ish
Okay.
naturally.
Okay.
So maybe a little more.
And you're still gonna need a little bit more to get that
if you
full.
want to form it like that. Again, I could be wrong, and it might be like the cup size you're trying to go for. So maybe if you just want like a small bump or something, then maybe they just like grow naturally and don't need to add anything to it,
Or maybe the hormones are for something else, but one of the side effects is that you still develop some breasts.
not sure.
Interesting take from the men's side. They always go back to like the pair.
Yeah, a cheap pair.
Yeah,
like a C cup. It was like, why is that a cheap pair?
and that's gonna be more of the surgical route anyway.
Yeah.
So I don't know much about this topic, so I'm interested to hear from our guests about what they have to say, especially since it is something to be mindful of when you're transitioning.
Yeah, definitely don't know. So we're gonna see. This is definitely a topic where we don't have a lot of the information at all. So we're gonna get it from someone who does.
And I wonder too if there's information out there, I mean, because this is still kind of new for our world, so I wonder what information is out there, and is it ever revolving? Will it continue to change whatever is out there?
Certainly, questions we have for our guests.
Yep,
for sure. So let's see what our guest has to say.
And continuing on with our conversation, we have Dr. Robyn, breast cancer doctor, advocate, radiologist, and boobfluencer joining us to talk more and add to this conversation. Thank you for being with us, Dr. Robyn.
Thank you so much for having me. I'm so excited to talk to you ladies today.
Yay, likewise.
Yes, you came with the breasty shirt on. You're ready to go for it.
always be breasting. That's what I say.
I like it. All right. So how did you get into your profession and becoming an advocate as a boobfluencer?
Let me take you all the way back. So it's kind of crazy and fortuitous how I came to be a boobie doc. I didn't, I almost went to college for journalism. I went to University of Florida, and I remember kind of being in this large auditorium room, and they were saying it was pretty much to show us at University of Florida that most of us are not going to make pre-med. So they basically were like, raise your hand if you're pre-med. So all these hands go up. And I don't know what came over me, but I raised my hand, and my parents were like, what? You want to be a doctor? And I don't know, something took over me. Growing up, I had personally struggled with growth hormone deficiency. So I kind of spent my younger years, my formative years, giving myself shots, going to lots of doctors. So I said, I'm like, yeah, I love Dr. Nemri. I'm good at math and science. Why not? And it was funny because my dad, he's like, he goes, I could see you being on the Today Show one day, being like a medical health contributor. And I was like, okay. This was 25 years ago now. So I go through med school, and I somehow make it through University of Florida without getting weeded out. And when I went to med school, my cousins, who I adored growing up, were diagnosed with breast cancer in their 30s. They were one of them was like 32, felt a lump, was told that it was nothing to worry about. It was probably benign. And she pushed for the biopsy because she felt like it didn't feel right. It ended up being breast cancer. She ended up having BRCA. Her other sister, who was in her 30s as well, had her first mammogram. Well, lo and behold, she also has breast cancer and has BRCA. This was before Angelina Jolie, so this is taking us way back. So I feel like in the back of my mind, I always knew I wanted to help women like them. So I when I walked into med school, I thought I was going to be a pediatric endocrinologist, so I could be like a growth hormone deficiency doctor. But then I just fell in love with radiology and the diagnosing, keeping them in the back of my mind, diagnosing and helping women like them. So that's kind of how I ended up in breast radiology. And then, so that was a very fortuitous path as well. And then the whole platform, the Booby Docs, was, taking it back to my writing, my journalism. I had the career I wanted. I had 3 kids, life should have been perfect, but I felt like I was missing something, and I missed like writing and creating. And I was talking to my therapist for a while about like, I want to start a blog. Like, I don't even know, am I a doctor? Am I a mom? Who am I? And I remember it was like one late night when I was breastfeeding my 3rd kid during the COVID pandemic. I realized I was surrounded by boobies all day. And I was like, that's it. I'm a booby doc. My grandma always called breast boobies. And so for me, it was like an aha moment. I literally changed the name, and like the rest is history. I've had some other bumps in the road. Like, I did this with my best friend who worked with me, my best friend from day one of med school. She's the S, but she quit social media. And so I've been carrying on the Booby Docs for the past few years, and it's been such a it's been such a wild ride. Like, I also have a podcast, The Girlfriend's Guide to Breast Cancer. Like, all these things have kind of happened naturally as an evolution of like my brand and just wanting to know more from the breast cancer community and realizing the impact that I can have on social media by helping all these people with, help to find their breast cancer early and empower them with the tools that they need to get through this diagnosis. So it's been fun.
Love that.
Amazing.
Yeah,
Thank
I like
you.
how it came full circle and how you were able to tie in the journalism in the end. I like that.
Yes.
And how docs is like a double entendre in a bit.
Yeah, it's totally, I mean, I think of the Booby Docs as like me. It's my evolution, even as like a 40-year-old woman. Like a lot of it was like trying to find my voice, and who am I speaking to? Like, who am I and who are you? I always say that's like a big part of my platform, is realizing who I'm talking to and who really am I at my soul.
Yeah.
You designed your own life.
I sure did. I still have not officially been on the Today Show yet, but we're working on it.
Hey, it's coming.
We
Yeah,
got time.
spoken into existence.
That's right.
When you said it, I was like, well, has she been on there? Like, I could totally see her on there.
We kicked it off on Breast Cancer Awareness Month on Hoda and Jenna a few years ago, but I've got my plans. I think next year is my year. I'm working on some cool projects that I'm excited to unroll next year.
Let's post it.
Yeah.
Love to see that
Thank
play
you.
out as well. Oh, and I was like, there was something else I was going to say. I just thought about it, just that it is important to know who you are outside of your many roles in this world. Like, just who are you? So it's
Absolutely.
good.
I think, the Barbie movie kind of made, like, it was around the same time, and it was like realizing you don't need to fit in one box. Like, I can be a doctor, I can be a mom of 3, I can be a content creator. Like, they're not mutually exclusive. And I could wear many hats at different times.
And do
We all
things.
can.
Yeah.
We all can. Yeah.
So, can you tell us what people who are transgender need to know about breast cancer risk and screening?
That's a very important topic. So it all goes down to what you, I guess, were born with, knowing your risk, because we know that if you are born female, but you take off your breast, like you do mastectomy and you remove your ovaries and a lot of the other things that or not even necessarily move your ovaries, but moving your breast cuts your breast cancer risk a lot. A mastectomy will lower your breast cancer risk by up to, greater than 90%. So that's something to consider. We would treat you as though you had a mastectomy, and, good physical exam each year. And And, if you feel anything, then we just, do imaging, which may or may not look like a mammogram or ultrasound. If you are the opposite, if you are a male who undergoes who transitions to a female, and you are taking the exogenous hormones, then you are at increased risk for breast cancer as well. So you might want to start. There's really no clear consensus at the moment about how often we should be screening these people, but we say typically about 5 years after exogenous hormones, we want to start screening with mammogram, and do that every year or two. It also has to take into play your risks, so other risks that you might have, like family history, that is independent of gender. If you were a female, you were born a female and you had menstrual periods, or you have some risk factors as well that we also have to consider. So treating each individual, like looking at their breast cancer risk as an individual, then also based on any hormones or surgeries they may have had. So I would really recommend finding a healthcare professional that is familiar with these recommendations and familiarize yourself with them as well, so that you can advocate for yourself, because a lot of doctors may not even be completely familiar with these recommendations, especially if they're not, if you're like in a more rural area or have less access to, more specialized doctors. I think that's an important consideration. So I think you have to be your own advocate at the end of the day. And I think this goes for everybody, that we also have to get comfortable doing a monthly self-breast exam, knowing how your normal feels, because everyone is at risk for breast cancer. If you have breast, then you are at risk for breast cancer. So, getting to know your own normal. I always tell people, choose the same time each month, look at your breast visually, make sure they're not enlarging and they don't have masses, or any, nipple indentation or tethering or something that you just never notice. The more you pay attention, the more you're going to notice subtle changes, and feeling your breasts, just to get to know how they normally look and feel. Maybe around, a few days after your period is the best time, but I always encourage people to feel it on the first, as long as you're doing, or Spondle Friday. So as long as you're choosing the same time each month, so you can know how your breast normally feels. And if you feel something, pay attention to it over the next few days while trying to get an appointment to see your OB, your primary care doctor, or any healthcare professional. And also, I always encourage people, let's say they do an exam and they're like, it's just a clogged duct. I always encourage people to push them a little bit. How do you know it's not a clogged duct? How do you know it's just a clogged duct? Is there any imaging test that we can do, or any test that we can do to make sure it's not something more serious? I would just feel more comfortable, and putting it on yourself, because like it most likely is a clogged duct, but we are seeing a young rise in breast cancer that we need to be aware of, especially in people that may not be routinely screened for whatever reason. These are the people that especially need a self-breast exam. So all those factors go into play for early detection.
Absolutely. And this is going to go with the age. For the males who transition to women, I don't know if there's any research out there or data yet. Is there anything out there that's indicating like young versus older at this time, or how many years after their hormones?
Well, I'll tell you that transgender individuals are more likely to be diagnosed at a later stage, because for a number of reasons. A lot of that is because they may have fears about going into the doctor, or the doctor not being familiar with like them as an individual and what they've been through. So I do think that we have to look at it through the lens of that. So knowing that, I think that we have to be a little bit more proactive, in the start. They say 5 years after hormone therapy, if you're a male to female transgender woman. But, again, if you have a strong family history, transgender individuals get genetic mutations. They have family histories as well. So I always encourage everyone, one of the newer recommendations is that they say all women, but I really think it's all individuals, especially those of Ashkenazi Jewish or Black ancestry, should have a breast cancer risk score, like a formal breast cancer risk evaluation before the age of 30, ideally at age 25. So we can identify people that are higher than average risk and may benefit from earlier or supplemental screening. So, I don't know specifically in transgender individuals, but I could tell you that in women, and especially Black women, we are seeing a younger, more aggressive subtypes coming out. So I think that is something that we all need to be familiar with, and just be your own breast advocate. Like, that's all I can say is, like, get to know your breasts, become, stay on top of your breast cancer screening, whatever that may look like. Typically we start, so for average risk individuals, so not transgender, just, cisgender females, we start annual screening mammography at age 40 every year until we say continue as long as you're in good health and desire to be so. So if you're, 85 years old and you're still have a great life, you continue. That's for average risk individuals. But for high risk individuals, so this is where breast cancer risk score comes into play, because a lot of people are high risk and may not know it. We might want to start breast cancer screening as early as age 25 with an MRI and age 30 with a mammogram, and kind of alternating every 6 months. So if you could run your own risk score, and I want to give this to your listeners as a tool, but there's something called the Tyrer-Cuzick calculator. It's TYRERCUZICK calculator. You could do it yourself. It will ask you your age, if you ever had a menstrual period, if you ever were pregnant. It will ask you about your family history, any known genetic mutations. It will ask your breast density, which you won't know unless you've had a mammogram. But you plug that in and it will give you your risk score. If it's over 15, that's considered intermediate. I would definitely get a formal risk score run. But if it's over 20%, that's high risk. And those are the people that we would start breast cancer screening, like I said, as early as age 25 with MRI and age 30 with mammography. So I encourage everyone to kind of run their own risk score or ask your doctor to run it. Better late than never.
Thank you for that tool.
Yeah, what is that?
Another tool, the Tyrer-Cuzick calculator. So TYRERCUZICK calculator. That's an easy tool that a lot of doctors will use to run your risk score. So if you've never actually had the conversation, or you may not have a doctor that you could just call up and get your risk score run, you could do it yourself. And there are, organizations that will help you, do genetic screening. Genetic screening has come so far, and it's now like, $200 out of pocket if you have insurance. There's lots of programs that will offer it for lower discounted. So there's all these resources that you can have, especially if we find out you're high risk, and that will help you kind of get the genetic screening and the high risk screening that you might need.
Thanks for that information. Why, or do we know why Black women are more at risk?
I don't think we know. I think it's a lot of multifactorial things. It's not even that they are diagnosed later in many cases. That's not the reason why they're being diagnosed with more aggressive breast cancer, but or younger. They tend to get these triple negative and more aggressive breast cancers as well. So I don't think we know exactly why, if it's something genetic, if it's something familial, if it's something environmental. It could be like a combination of all of those things. But yeah, it is an issue. And it's something that I just want your listeners to be aware about, because again, I think that you have to understand that most people who are diagnosed with breast cancer don't have a family history or known genetic mutation. So like I said, we are all at risk. And you're not too young to get breast cancer. Like I said, young breast cancer is on the rise. So it's just something we all have to be vigilant about. And again, getting to know your breast, doing your monthly self-breast exam. I think the recent data shows that about 80% of young people who are diagnosed with breast cancer find the tumor themselves. Mm-hmm. So this is really why I am a strong supporter of the monthly self-breast exam.
Okay.
And then advocating for yourself when you find something that you know is wrong or that doesn't feel right, and knowing that, and advocating for yourself to get the appropriate imaging workup that you might need, rather than just being told that it's nothing to worry about.
If you learn nothing else today, you learn to advocate for yourself.
Absolutely. Mm-hmm.
I like how it's important even to hear from a doctor. I know that it's important to advocate for yourself even when you are at the doctor, because I think a lot of times in those spaces, people feel like, oh, well, they're the doctor, they know, or they might feel intimidated because they're the doctor, they know. And sometimes doctors can be like, I know, so I think it's important to
Yes,
say, hey, how do you know that
right,
it's,
right.
and,
I think that's, yeah, it's a hard skill. I even have a hard time advocating for myself. I recently had a health incident where I knew my wrist was getting infected after a surgery. I asked to be seen. They couldn't see me. I ended up needing surgery. And I'm like, I should have advocated for myself. I think that we have to, know that doctors are humans too. They are not familiar with you. You honestly do know, I always say, your body breath. Like, you know if there's a problem. Oftentimes, I think that medical gaslighting is a real thing. I hate to see it, but it's real. And I don't think that people even do it intentionally. It's not always like but minimizing, especially we know that women and Black women especially get medically gaslit a lot. So it is something that we have to get comfortable having that conversation. I tell you as a doctor to do that, and if your doctor gets offended and like you feel like you can't talk to them like that, it might be time to find another doctor, because I think it's really, you're part of your healthcare team as well. I think we have to start looking at ourselves like that. And, because of social media, you might follow the booby docs and know that like, hey, I should be getting this risk score. And you like, if they're like, you don't need it, you don't have a family history, you're like, no, but I have these other important risk factors. Like, educating yourself is the best thing that you can do. I try to educate and empower people to have the tools that they could bring to their doctor and be like, hey, did you know about this recommendation? Or did you know this? Because I don't blame them. Like, a lot of times general practitioners and OBGYN, your breast health is not their main concern. Because they've got so many other things that they have to take care of, especially if you have a complex medical history. So I feel bad for these people that, have to kind of deal with all these, disease processes. At least like, my focus is breast cancer. So I encourage people to be your own health advocate, but I think it goes across everything. It goes for just general health as a woman, as a person. I think doctors need to start also. I think a lot of doctors do this very well, but listening to your patient, listening to their concerns, and also if you don't feel like your concerns are being met, ask specifically, what are we going to do about this breast lump? Let's focus, because again, they have a lot on their plate that they have to be in charge of. So, if you be self-aware and be your own advocate.
For sure. That's definitely important to know.
Yeah.
It makes me think about the trending topic where they're like, XYZ hates to see me coming. So like, I'm thinking about how doctors might feel towards women, well, pay anyone, male and female, that are being educated by the internet, like booby docs, and then they come in and advocate for themselves. Like, well, on booby docs, they said, and doctors like, here
I
we
know.
go. Here's this.
I get nervous.
Social media one person.
Yeah. Well, I think that's important. I think that you have to also understand, for information, for health information on social media, for all information on social media, but especially health information, you have to look at the source. So is this person an expert? Are they trying to sell me something? Is it possibly tied to what they're trying to tell me? Because I see a lot of misinformation on social media, especially with regards to breast cancer. But I am giving you evidence-based medicine. The person who's trying to sell you on thermography or QT imaging, who also is a founder of the QT imaging and has their pockets in it, it's a very different type of thing that they're doing over there. Like, that's trying to scare you away from getting, I see these things all the time. I'm constantly facing on head on and for misinformation, because I see out there, mammograms cause breast cancer. That's what that's their hook bait, right? And then they're going to tell you how it has radiation, and radiation's bad, and this has no radiation, so this is good. And, enjoy my program, and I can guarantee that you won't get breast cancer. It's like, that drives me nuts, because there are people that listen to that. It gets a lot of likes and clicks because it's so shocking. You're like, what is this person? What do you mean? All my doctors have been lying to me for all these years. It's creating this kind of system of mistrust, and it's hard to know who to trust these days. So that's why I think you really have to vet your authorities and see if they have any financial conflict of interest. Like, I don't make money by the amount of mammograms women get. Like, I'm a radiologist. I'll read whatever they put in front of me. But I'm not trying to also sell you my new imaging technique over here at the same time. That's not FDA approved and is not doesn't have science to back it up. So I think it's a really scary time as a health consumer out there. Especially, I saw a recent study that over 50% of young people get their health information from TikTok. That's why it fuels my fire of why I need to put this information out there, because there's so much bad information that we need doctors like myself who are willing to put yourself out there. It's not always comfortable putting yourself out there at the judgment of others. It's like, this does not help my professional reputation. If anything, sometimes I feel like it hurts in the hospital setting. So I think that you really have to be passionate about it and realizing that there's a problem here in just the way that we're consuming health information and distributing it. And also, trying to have these open and honest conversations with our healthcare professionals, but not in a threatening way, like in a not I know everything way, but like in a let's do this together, we're part of a team. I think we have to start looking at our healthcare professionals like that and the patients like that.
Makes perfect sense.
Yeah. Thank you.
Do you think there are any concerns that will come about in the future as technology for procedures may change for people who are transgender?
I mean, I think that we're going to screen transgender people the same way we screen women, like as we should. They have breasts, and if they have, the hormones to support breast tissue, then we should be screening them. I think on the horizon, I think we see a lot of bad press about mammograms. Mammograms are a tool. I want to talk about this because I think it's important. Mammograms are a tool that we've been using safely for the past 50 years. The quality has improved over time. The dose has gotten lower. A mammogram is very low dose. It's equivalent to about 7 weeks of background radiation or flying cross country. So it's the only imaging test that I know of so far as a breast imaging expert that can detect microcalcifications, which can be the earliest form of breast cancer, ductal carcinoma in situ, or DCIS. So, but mammograms are not perfect, especially if you're someone who has dense breast tissue. And this is important. So the only way to actually know your breast density is by reading your mammogram report. Under that, there will be a section called breast composition, and the radiologist essentially assigns you 104 breast density categories based on how much dense breast tissue you have. So A is fatty, means that it's less than 25%. B is scattered, that's 25 to 50%. They are not dense. But if you read your breast imaging report and you see that you have heterogeneously or extremely dense breast tissue, then you have dense breast tissue. And this is important to know because, one, it makes the mammogram not as effective as a screening tool. So the way that dense breast tissue appears white on a mammogram, and so do breast cancers, okay? So think of it like trying to find a snowflake in a blizzard. The more snow you have, the harder it is to find a single snowflake. It's the same principle for breast cancers on the mammogram. The other thing that we know now that we didn't know before was that having dense breast tissue increases your risk of having breast cancer. So it's kind of like a double-edged sword. So it makes it harder to find small breast cancers on mammogram alone, and it also increases your risk. So I always encourage people that have dense breast tissue to consider adding a supplemental, like adding on an ultrasound or MRI, depending on your risk factors. Typically, we reserve MRIs for people that have greater than 20% lifetime risk of breast cancer. So that's why knowing your breast cancer risk is important. But if you're, average risk, but you just have dense breast tissue, by adding on an ultrasound, we are able to find smaller breast cancers at a more treatable stage, potentially avoiding things like chemotherapy or lymph node dissection, or, in some cases, even radiation therapy that have some side effects. Sorry.
And I'm one with dense breasts and have a severe family history. And so I started mammograms early, and I even have to advocate for myself. I need this now.
Good.
And then, like you said, needing other tools as well, because I know the risks. So you do have to push for yourself,
So
especially if you're young.
Yeah. So if you have dense tissue and you have a family history, like, I think even just fully qualify for an annual MRI in addition to your mammogram. So I don't know if is that what you do?
I didn't know that, but my mom did the BRCA,
So
and
that
she doesn't carry the gene, so I don't know if that matters.
Okay. So it doesn't matter because, okay, so I'm glad you brought that up, because I think that with that history, you might get a false sense of reassurance that you're not at risk for breast cancer.
Okay.
Well, number one, most breast cancers, greater than 90% of people who develop breast cancer don't have a known genetic mutation or family history. So you don't have the genetic component that we know of yet, but it also depends when your mother took her genetic screening. So if it was greater than 5-10 years ago, they've come out with, they have more versions of BRCA testing that we know about. And there's other, like, over 60 cancer causing genes that a lot of these genetic screenings test for. So even though she might have been negative for BRCA 10 years ago, you don't really know where you stand. So I do encourage people, like I said, to consider genetic screening. Well, definitely running your breast cancer risk score on the family history and personal history you know about through that Tyrer-Cuzick calculator that we talked about. But also consider looking into genetic screening if it's something that you would want to know about. But knowledge is power. Like, if you knew that you had a high risk for breast cancer, there are things we can do to A, lower your risk of developing breast cancer, and B, finding it early, so that we could, we might add an MRI, kind of alternating with your mammogram, especially in the setting of dense breast tissue. So you're never going more than 6 months without some kind of breast cancer screening. So that's how we kind of treat the high risk population. Yeah. So it's something to look into.
Thank you.
And one other piece of information I wanted to share is that coming September 10th, actually this year, there's a breast density notification law that every woman has to be informed of their individual breast density on September 10th. So that's something that you will now hear a lot about. So now you'll be educated to know what that means and what that means for you.
All righty.
Have you seen an increase in patients who are transgender? You have?
Yeah, actually. So my institution actually has a transgender health department, which I think is so wonderful. So I do feel like that we have a higher population of transgender individuals come in. And I think we'll see more of that. I specifically haven't seen any breast cancer diagnosis in transgender individuals, so I know they're there. I just haven't personally seen it. I also want to shout out my friend. She's a breast radiologist, and her name is Dr. Rad Idea, IDEA, and she is she's a part of a lesbian couple, but her whole platform is to be focusing on the LGBTQ breast cancer needs. So I think that's a great page to follow as well.
All righty. Good to know. Yeah. Do you have any raw recommendations specifically for people who are transgender?
Well, they've come so far in the prosthesis side. So I don't know if that's something that, I don't know where, if they are somewhere in the process of wanting to put on a breast prosthesis, they have beautiful ones like that they use in the breast cancer community, but certainly it can be utilized in the transgender community. Other than that, I don't specifically know of any specific to that. I'm still trying to figure it out for the cisgender community myself. I actually just tried some Third Love bras and I love them, but always on the hunt for a good bra.
Aren't we all?
Where would you like to see your brand in the next 10 years? I know you say you have some plans.
Oh, that's a good question. Well, okay, so just to manifest a little bit. So I've written a children's book that I'm going to be publishing hopefully next year.
All right.
If I could find a publisher, an illustrator, willing them into my world. I'm going to be a news correspondent and on definitely the Today Show, but we'll do some local stuff. I actually have some appearances coming up this breast on Fox News Philly. So I'm excited about that. And I run an annual fundraiser, the Booby Bash, which is the Booby Bash. It's like a Halloween masquerade thing. So I want to keep doing that for the next 10 years. I love it. And every year I rotate the organization that I'm helping. So this year we're doing Living Beyond Breast Cancer. Last year was Unite for Her. So definitely want to keep doing that. And I just want to keep spreading my brand and my awareness, because I know personally I've helped lots of people find their own breast cancer early. So that is what keeps me going. So more of that. Keep spreading, creating the movement.
I love it, the movement.
Yeah. What about you ladies? What's on your
We haven't had that thrown back at us.
I know. That's what I was like, whoa.
Look at you. You're going to do great things.
I want to travel to the Booby Dash.
Yeah.
That's like booby events across the world.
I love it. I love those Booby Bash. Yeah, it's a masquerade. So it's pretty sexy. It's I call it Not Your Grandmother's Breast Cancer Fundraiser, because last year was my first year doing it, and we had 275 people, and we raised 23,000 for Unite for her. And this year I'm expecting like 400 people, hopefully. So, but what's on your 10-year vision board? You can't get out of it.
I'm not. I would just say ultimately to be able to continue this breast journey and make my mark in this industry of everything revolving around breast, basically. And yeah, I don't think I have anything specific. A sit down with Oprah, that's always been on my list.
That has been.
Yeah.
You got better make it happen in the next 10 years.
Yeah, it's
me
gonna
too.
happen. So
me too.
That would probably be like my biggest thing, my sit down with Oprah. And just being even more, what was I gonna say? I was gonna say like well known, but like I said, just making my mark and expanding that reach even further.
Love that.
Doing. Oh, and I would put uplifting in multiple cities. The bra business that I would have it in multiple cities. It's a mobile bra business, and they need it in multiple cities.
Oh, I love that.
Did I forget that one?
Uplifting is such a good name for a bra business. Oh my God, I love that.
My
what about you, Chantel? That's so smart.
It's so random.
No, it's good. You know what you're getting.
Yeah.
So my 10-year plan, so I designed sports bras for full bust women, and I am on a mission to reduce the bounce by at least 95% for a lot of women. I am currently, this is recent, maybe pursuing a PhD, because I want to become the sports bra leader here and have a lab for bounce reduction. So I'm working on that.
Bounce reduction.
Yeah.
I love that.
Yeah.
Very cool. And I have to ask, what is your, are either of you in the transgender or LGBTQ community? Is that why we wanted to focus on that group? Or you just want to target that audience?
So it's just because, like, everyone for Breast Cancer Awareness Month, it seems like sometimes it's always like the same conversations. So it was just like another way to provide information revolving around that topic, but giving more information a little outside of the box. Because I feel like it's always just like, oh, women, breast cancer, yeah, get your screening, do your checks, blah, blah, blah. But it's like, oh, well, no one's really talking about this. And that's something that people should know about. So,
you're absolutely right. I love that. Yeah, no, it is so important. And I'm glad that you brought up this topic, because I do think it's, it's something that we don't talk about, and we should be. I think we also have to talk about male breast cancer. Beyonce's dad had breast cancer. I think we have to normalize it. Like, anyone with breast can get breast cancer, and I think we have to get comfortable talking about our breasts. And clearly we're doing the God's work over here.
Exactly. say
The
that
words
often.
work. That's right.
It's like people
Well,
are already talking about breasts that much. So
yeah,
imagine all of these other subcategories of breasts that they're not talking about. So that's what
absolutely.
we're here for.
I love it. I'm with you. I'm with you.
We're with
Absolutely.
you.
Well, thank you so much for having me. This was so fun.
For sure. Thanks so much for joining us.
Yeah. Before leaving,
Of
where can
course. Is there
folks
anything else
find
you?
you?
Yeah.
Yep.
People can follow me at the Booby Doc across all social media platforms. You could also check out my podcast, The Girlfriend's Guide to Breast Cancer, wherever you get your podcast. And yeah, stay tuned for some exciting new things coming up over here.
Of course. And although you've said plenty of positive things, we like to get your breast advice and leave with some words of positivity. So what's some words of positivity that you like to throw out there?
You must be your own breast advocate. Okay, be that in your breast health, your personal health, your job. Just go through life advocating for yourself, because you know your body best. You know your body breasts. You know what you desire in life. So I think you just have to keep that in the back of your mind, and don't be afraid to advocate for yourself.
Absolutely.
No one will do it for you. Yeah.
Absolutely.
You heard it
Say
first.
better. Exactly.
From a doctor.
All right, this has been great. I learned so much. So thank you for sharing your wisdom and expertise. And we look forward to staying connected and following your journey these next 10 plus years.
Good.
Sure. I did have like
Thank you so much. Absolutely. Let's do it.
So we hope that you enjoyed this episode where we discuss breast health concerns and risks that there are for people who are trans. And we took like a less traditional route for this October just because everyone's gonna always just think pink, think pink, or just think about women and breast cancer. But we wanted to delve a little deeper and make sure that we are hitting all of our audiences and covering all the bases when it comes to this. So to further go into the less traditional route, we're going to talk about some other essential things for your breast health as we carry on with this month of breast health awareness and breast cancer awareness. So tune in 2 weeks when we come back with some more good information. Be sure to shop with us at boobtubepodcast.net and follow us on the socials at boobtubepodcast. And make sure you let us know what you think. Share with your friend who might need this information. And yeah, we can't wait to see you. So until next time.